Hi, I'm Liz Robson-Kelly, CEO of Worth It. This short video introduces you to our whole school system model for developing positive mental health and wellbeing. This model was created to help schools find a pathway through developing whole school mental health and wellbeing. We've created a system approach because every area when developing whole school mental health has a knock-on effect to another area. For example, if you improve the well-being of your staff, it improves interactions and relationships with children, which then helps improve their well-being. This framework will go through step by step and explore each of these 10 areas in more detail so you can understand how this will help you lead and implement a whole school approach to positive mental health and wellbeing.
The first part we're going to focus on is at the core, leadership and management. Really, to develop an effective whole school approach, you do need leadership and management on board. So the group of people you might need to influence the most as a senior mental health lead are your fellow school leaders. And really, you need about 70% of those school leaders to be on board with mental health and wellbeing to really create the whole school approach that is going to be sustainable and embedded. So you might get some skeptics and you might get some stragglers that you really need to convince. And how we do that is through the learning case for change and the mental health case for change, and really making sure that they can see the urgency of the situation and why it really is important to invest in developing mental health and wellbeing. And once you have a leadership and management team on board, then they can start to look at policies and processes and providing a bit of space and time for this work to be done. And when they do that, mental health and wellbeing become an integral part and are considered as part of your school strategy and planning. So mental health and wellbeing are on the agenda at every team meeting. They are integrated into your school values. They are embedded in policies and processes and the actual physical environment of the school. The next thing to focus on is developing your staff's capacity to be able to support mental health and wellbeing. And there's a two-pronged attack to this. Firstly, enabling staff to develop their own wellbeing and also collectively as a team so that they can support each other. As we know, relationships and connection are really important for facilitating wellbeing. And also that staff are provided with training in ways to support pupils, not only with poor mental health, but in ways to teach effective promotion of mental health and wellbeing that protects wellbeing and enables us to prevent the onset of mental health problems that we've talked about earlier in the course. Once your staff have good wellbeing, it's really important that they've been given some time and even a little bit of budget if that's possible, but if not, time's most important, even if it's an hour and a half term, to help them develop their own staff wellbeing initiatives. These are ways of bringing your team together to develop positive relationships that underpin all staff wellbeing and help your staff to lead initiatives that they identify as important for their wellbeing. So these might be specific and different for each school. Strategies include workload reduction approaches or team building, a range of health activities that they can come to do together as a team, and that you're providing them time and space to develop those staff-led wellbeing initiatives that really matter to them. The Universal Taught Curriculum for Wellbeing focuses on the explicit teaching of wellbeing strategies that enable children and young people to flourish, and that those opportunities exist within the curriculum for all pupils. It might mean specific lessons or drop-down days or off-curriculum days or events that are one-off, as well as embedding strategies for wellbeing into your wider curriculum and really taking a creative approach to that. Also, pupils and students have the opportunity to help shape that curriculum through voice-led work, through asking them what strategies they need to focus on to help them develop wellbeing, and that they're also provided with opportunities to lead positive mental health and wellbeing approaches with their peers, either through initiatives such as wellbeing ambassadors, anti-bullying ambassadors or mediation, or more informally around just the way we help each other regulate our emotions or share mindfulness approaches and develop that quality interaction that they're taught explicitly in the curriculum. Once you start to teach your explicit curriculum and you improve the quality interactions and relationships between children and teachers and each other and staff, you'll start to get an emergent day-to-day experience of wellbeing, which creates and contributes to this ethos or atmosphere of wellbeing that you just feel or know is there. And that ethos of wellbeing creates the positive environment for learning. It also actively cultivates strategies for wellbeing through day-to-day experiences and interactions at school. That can include rituals and routines that you have in your school, such as achievement assemblies or golden time, prom or sports day, or anything that really can enable children to experience well-being and strategies for well-being more informally than being taught in the curriculum. And that they're just experiencing well-being by going to your school. And this is something that I'm really passionate about creating with schools and colleges, is that just by going to the school or college, that they experience well-being through their day-to-day interaction, through the quality, connections, friendships and relationships. Our next area of focus is targeted prevention programs, and that you are creating or reviewing the range of prevention that is on offer in your school. So what happens when a child or a young person is recognised to be in need of further support than can maybe be offered in the wider curriculum, or that can be addressed by just the atmosphere of your school, and that they actually need a bit of an intervention or a bit of support. And that you offer a range of targeted prevention programs to help at-risk pupils or at-risk young people prevent the development of mental health problems. So these could be specific targeted cohorts, such as LGBTQ young people, young carers, those who you know are having problems at home, those who might have been bereaved, those who have a lot of exam stress or are feeling anxious. So children and young people that are maybe below a threshold to need a specialist provision, but could do with a short-term intervention or a short-term program that's going to help them increase their ability to engage in wellbeing strategies. And that you identify the needs of pupils and provide access to support to address those needs, so that you're looking at what they really need and that you're matching the prevention provision to meet their needs. And then you're evaluating the impact of these interventions and reviewing how they go, and so you're improving the quality of those prevention programs to suit the pupil or student's needs based on what you're learning from evaluating the programs that they're attending. One of the key areas you'll be developing as a mental health lead is your pathway to specialist provision. So this is how you develop a pathway out of the support that's available in your school or college setting to something that's provided maybe in the local NHS or in the community or by third sector organisations for those children and young people that might be struggling with mental illness and need that specialist support that is beyond the capabilities of what you can offer in school. So that you have a clear pathway that you know how to access, and staff and children know how to access that pathway. And it's not stigmatized. It's open to everyone who feels that they need it. And because you've created this culture of acceptance and understanding, it's much more accessible for children and young people to access that pathway, and also for staff to refer onto it. In order to develop your pathway and your ethos, you'll need to work in partnership with agencies and key stakeholders. These can be mental health support teams if you have them local to you, local services that are procured by the local authority or the CCG, such as training, counselling or online services for children and young people, eating disorder services or support groups. So building up that network with your external agencies to provide appropriate and specialist support based on the pupil or even staff needs. If your staff are struggling with their mental health, it's really important to refer them on to specialist support too, and that they provide an integral part of the support that you have on offer for your pupils and students and for staff wellbeing, and that you also review the partner agencies that you have and you keep up to date. Quite often things, especially in charities, can change, so that you're keeping an up-to-date record of the support that's available to you and that you're accessing it. Sometimes there's a lot of support available, but because schools are so busy and they don't have these clear referral pathways in place, that you miss out on some of the funded support that's available in the community that could really help the children and young people that you work with. Working with parents and carers is also really important for your whole school or college approach. Obviously, the older the young people that you work with are, the amount of input from parents is different to that in a primary school, but parents and carers understand the value of the school or college approach to positive mental health and wellbeing, that they can find information out about policies and processes for promoting and supporting mental health. Parents are involved in contributing to the approach, and that their voice is also heard through stakeholder involvement, and you're working with them to support them to develop skills that help their child develop wellbeing and flourish. All of these other areas feed into the culture and ethos that creates that environment that promotes and supports the development of positive mental health and wellbeing. That the school's approach to mental health and wellbeing is shared, understood and visible. So you can know when you walk into that school or college that mental health is important. You can feel it in the atmosphere. It feels like a happy place. It's visible. People know how to access support, but there's also things around the school or college buildings, displays that are positive and affirming, that help you know that mental health and wellbeing is a priority, and that the school's policies and procedures support the development of positive mental health and wellbeing for all. That mental health and wellbeing is core business in your school or college. If you want to apply this whole system model in your school or college, the best thing you can do is join our Wellbeing Club. Wellbeing Club is an annual membership enabling school leads or school mental health leads to really develop a whole school approach to positive mental health and wellbeing. We've designed Wellbeing Club to provide you with bite-sized courses, resources and examples that you can use no matter where you are on your journey to developing whole school mental health and wellbeing, providing you with an invaluable resource toolkit that really helps you with the how of developing mental health and wellbeing. We hope to see you inside Wellbeing Club soon. If you have any questions, do get in touch with us and we'll be happy to help.